Good morning. We're from the Clinical Research Learned Unit in Nursing, led by teacher Mariscal Delgadillo Monserrat. The team is integrated by Campos, Enriquez, Julieta, Alejandra, Cruz, Gómez, Fatima, Yadira, Davalos, Negrete, Jimena, Isabel, and Cruz, Hernández, Sofía. Our poster the teacher nursing care process in the early diabetes patient with acute myocardial infarction and compensated metabolic acidosis from the theoretical perspectives of self-care by Dorothea Oren. By way of introduction, we have that acute myocardial infarction constitutes the most severe manifestation on ischemic heart disease and emerges as a consequence of the subject blockage in the coronary arteries, precipitated by the rupture of atherosclerotic plaques. These blockages cause myocardial ischemia and in the completed trigger necrosis in the affected cardiac tissue. The early pathology processes atherosclerosis below in size gradually narrows the vessels and being exaggerated by multiplicable rich factors such as smoking, diabetes mellitus, dyslipidemias, obesity, and high blood pressure, which increase the demand for oxygen in the compromised heart. Clinically, it can manifest with cough, oppressive chest pain. These present atypical symptoms specific and vulnerable population should order adults. The morbid association with the insignificant in Jalisco, Mexico, a high prevalence a day related to smoking is reported, and the national level heart disease lists as the cause of death. In the magnitude of the problems, Dorothea Oren self-care approach emerges and appropriate framework for managing this cause, underscoring the importance in the patient active participation in the recovery and management of care. The objectives of our clinical cause is the applied Dorothea Oren theory, our self-care, the stability, the particular requirements towards specialized intervention for rehabilitation in the cause of the early diabetic patient who suffered an acute myocardial infarction with elevated on the ST segment.
Regarding the clinical case, upon evaluating the case and applying Dorothea Oren's theory principles, we have identified critical aspects in the patient's condition, such as universal self-care requirements, where the patient exhibits a deficit in the proper supply of oxygen, indicating an insufficiency in his pulmonary or cardiac capacity to meet adequate oxygenation on its own. A significant deficit is also identified in effectively managing health condition due to his diagnostic of acute myocardial infarction. This hinders the patient's ability for self-care without assistance. Similarly, the patient clearly has deficit in self-care as a result of his health condition, requiring medical intervention due to his compromised.
In the diagnosis and intervention, a systematic review of the most outdated information was conducted in which the intervention for nursing care plans were identified. One of the diagnoses identified was the risk of electrolyte imbalance due to the compensated metabolic acidosis that the patient presented. The considered intervention was the management of electrolytes in the patient, which involves instruction to patient and family about the diet, to follow and monitoring fluids to keep the patient well hydrated. In regard to this intervention, it was observed that the recognizing personal risk factors in relation to the risk control intervention, the patient who was in the moderate deviation from the normal range moves to a level without deviation. Regarding self-care in non-parental medication, the indicator is recognition of beginning of the symptoms, going from systemically compromised to not compromised.
In conclusion, the implementation of Dorothea Oren's self-care model in the case of a patient who had an acute myocardial infarction helps us to have a comprehensive vision of the demands and care needs that are required. Being an elderly patient, we know that the intervention we carry out will have to be focused on self-care in order to avoid rapid deterioration by empowering the patient according to the management of their health. The theory provides us with a basis to carry out appropriate activities according to the self-care deficit that the patient presents. So having a strategic plan tailored to the patient helps in preventing a second possible heart attack this achieving an adequate recovery with a comforting pace of life. The intervention of the nursing professional has the ability to motivate the individual to develop self-care skills as an educating agent and get through the learning process defined by OREM. For your part, it will be everything. We appreciate for attention. Thank you.